Well, tonight in a special report, abortion access was federally protected for 5 decades. But 2 years ago, this month, the Supreme Court overturned Roe v. Wade. Now advocates say Louisiana's abortion ban could harm one group of women who have the highest maternal death rate, according to the CDC, in the state and country. Take a look.
It was June 24th, 2022.
This fight is going to continue.
Louisiana's abortion ban, now the law of the land.
That day was probably one of the best days of my life.
Advocates reacting to the news on both sides.
We cannot silo off abortion care from the provision of comprehensive reproductive health care.
Not only kills the baby, but it also harms the mother.
But around that same time,
we found out in the summer of 2022 that we were expecting.
Caitlin Joshua prepared to be a mother again.
My daughter is now 5, but at the time she was 3, almost 4, and we were just kind of thinking perfect time to add another baby, and we're really excited to do that.
But all that excitement quickly turned into endless doctor visits.
I called several different medical providers across the parish, but everybody said the same thing.
Confusion.
My provider's office stated that they would not be able to see me until the 12-week mark.
And pain.
The pain that I was experiencing was worse than what I had experienced delivering my daughter.
Caitlin says she thought she was having a miscarriage right around the time Louisiana's strict abortion ban was enacted.
The fetus has completely stopped growing. And at that point, my gut just hit the floor. I was so sad.
Medical providers and doctors too afraid.
I asked her, I said, so is this for sure a miscarriage? Am I not going to be able to continue this pregnancy?
To even diagnose or treat her.
She said, I'm not sure, and I can't really tell you that in this moment, but I am sending you home with prayers.
Caitlin had no choice but to go home and wait until the miscarriage passed. She says if the law had been different, she would have had access to an abortion, the same procedure often used during miscarriages.
My experience has definitely shaped how I think of maternal health care now.
Latoya Harris says she too looks at maternal health differently as a Black woman.
Sometimes we're seen as disposable, as far as just the staff not taking the time to realize our feelings are as valid as anybody else's.
She says she almost didn't make it out of the delivery room alive.
I went into a scheduled, medically induced delivery. I was given an epidural that didn't work.
She says she wasn't listened to by her doctors.
I definitely didn't feel heard.
Latoya kept telling medical staff that something wasn't right.
After losing so much blood, I passed out, and I woke up to just wondering, did I cold or had to be revived?
But she pulled through, and so did her baby girl. Latoya and Caitlin are not only mothers with survival stories, but they also represent a statistic. According to the CDC, Black women have the highest rates of pregnancy complications.
What would it have been like for her life to not have me around?
My husband and I, we grieved through the last pregnancy.
Both women thankful to be alive, knowing they could have been among thousands of Black women who died during childbirth.
They're oftentimes living on lower incomes than their white counterparts, and they are also facing implicit or even sometimes explicit racial bias within the healthcare system.
There needs to be just more health care during the pregnancy that's provided to them, as well as support with information about the risks that could be involved and those sort of things that could help them have a safe birth.
In fact, the CDC says Black women have the highest maternal death rate across the country and in Louisiana.
There's a lot of existing health disparities that exist already along racial lines in the state of Louisiana. Black women are less likely to be insured.
We know that there are women that become pregnant and then they don't have doctor visits, they don't have access to those things.
Now that abortion access is prohibited in the state, pro-choice advocates think the number of Black women who die during childbirth will go up because they will be forced to carry pregnancies to term.
We have lawmakers, not doctors, that are making these policy decisions, is actually adding to those structures of disparity. And the problem is not going to get any better when we restrict healthcare services. It's only going to make the problem worse.
the pro-abortion rhetoric we hear all the time links maternal health care, especially in the African American community, to the lack of abortion access, right? And those things are completely separated topics altogether.
A CDC report found about 40% of women who receive abortions are Black. The report citing Black women are more likely to live in poverty. A report done by the National Institute of Health found Black women are more likely to live in contraceptive deserts. According to nonprofit Advocates for Youth, Black women face barriers in getting proper sex education. Then, this study, also backed by the CDC, revealed Black women face high rates of sexual violence and have the highest rate of unwanted pregnancies.
Punishment should not be toward the unborn child. The unborn child is an innocent party in it.
We can't judge a person for why they make that decision or why they would seek an abortion.
Advocates on both sides agree on one thing: the disparities in healthcare have to end. And that's going to take money and resources.
We are not investing in families. We're not investing in women. We're not investing in people who can become pregnant.
There is more that can be done to improve maternal health outcomes, as well as help women and support them throughout their pregnancy and after their baby is born. And that's something that we are working to do by providing funding for abortion alternatives and things like that in the legislature.
But many like Caitlin don't think lawmakers or anti-abortion advocates want to.
It doesn't fit the narrative of the pro-life movement to address the healthcare disparities. It's so much more cuter, right, to create a study than it is to actually throw dollars at an entire community addressing a maternity care desert or sex education in school.
Educating youth, providing support to pregnancy care centers, helping with funding for those resources. So that's our whole mission, and it's not solely about just that unborn child. It's about caring for the mother as well.
And until they do,
it's all about control. It's all about making sure that women understand our place.
There will be more stories like hers and LaToya's.
By the God's grace, He protected me. Our life matters.
I'm Renae Skinner reporting.
Tracking the Tropics is